Gift of Life International was established in 1975, exists in 80 countries across 5 continents with 84 affiliated programs, making it the largest NGO in the world in providing world-class cardiac care to children with congenital heart defects by conducting open heart surgeries and catheterization for all children in need everywhere. Last month, end of September, we celebrated our 40,000th child in Kosovo, and the surgeries are still counting. This week, Gift of Life International has provided a volunteered cardiac team of 7 doctors and nurses from Lebanon Children's Hospital, and another 3 doctors, including the team from the US, from Denmark. This team is led by Dr. Umar Boston, our Pediatric Cardiac Surgeon. This mission is in collaboration with our local medical expertise from Jordan University Hospital and organized by Dr. Iyad Al-Ambouri and Dr. Layla Totanji to perform open heart surgeries for Syrian refugees. So far, we have 3 children recovering in the ICU and doing very well, and we have 3 transferred to the floor. One of them should be discharged today.
Well, I think the figure that you should use is that in 8 to 10 in 1,000 live births will have congenital heart disease. It's the most common congenital defect that babies are born with. We actually don't know. There are a few defects that have some genetic abnormalities related to them, but for the most part, it's just an unfortunate event during pregnancy. Actually, you know what? I think there were, at least in the United States, there were less births during the year 2020, and as a result, we actually saw a decrease in the number of children with congenital heart disease.
Regarding this mission, we have selected several children, mostly refugees, because Jordan University Hospital has been the hospital that receives most of the suspected cases with congenital heart disease from the Syrian refugee community. We have noticed that Jordanian children with congenital heart disease are probably at a little higher incidence of the congenital heart disease is a little higher incidence than the worldwide. In a study that we did, we have probably 12 per thousand compared to the 8 per thousand in worldwide. We also have noticed that congenital heart disease in the Syrian refugees are commonly either diagnosed a little later than the Jordanians, and we have a fair amount of very complex kids with congenital heart disease, both in Jordan and also in the refugee community. So a selection for those babies for cardiac surgery, either through Jordanian physicians or by the missions that we just had one, sometimes is critical, and it's a sensitive issue that we don't want to select very complex ones, and on the other hand, those patients need help. So the selection has been with discussions, really comprehensive discussion with the visiting team. So we have been discussing the selection criteria for the past several months with the USA team, and we carefully selected the patients who will benefit the most, and thankfully we had a very successful mission, and some of the patients are actually going home today and tomorrow, and a few are recovering, and the patient from today is really doing well, the operation that was done just now.
أطفالنا is a non-profit organization that is dedicated to help children in need below 18 years of old. Basically, we treat all kinds of diseases for these children, regardless of their origin or nationality or ethnics, and we support in giving them the best medical treatment available for these kids. Now for Atfaluna, we treat more than 400 children a year on average with major operations and in orthopedics, in cardiac surgery, and in all different specialties. And we also partner with different organizations, such our partnership with Gift of Life for this mission in treating cardiac patients and giving them a better life for these kids.